A research article published last week in the New England Journal of Medicine is drawing criticism for its endorsement of racial segregation among medical students in the United States. Now, the paper was authored by 7 researchers, doctors, and students at the University of California, San Francisco. And they write, founded on legacies of colonialism and racism, medical education has historically centered white learners and continues to perpetuate structural racism. Some Black, Indigenous, people of color, people have been socialized to care for the egos of white people, to express their emotions only in ways that are palatable to white audiences, and to tread lightly around white fragility. In a space without white people, Black, Indigenous, people of color, they can bring their whole selves, heal from racial trauma together, and identify strategies for addressing structural racism. To help us understand what this means for education, medicine, perhaps broader society, I'm joined now by the author and bioethics professor, Arthur Kaplan. He's with NYU's Grossman School of Medicine in New York City. Professor Kaplan, it's good to see you again. I just want to let you know and our audience know we reached out to the authors of this article and they declined our offer to come on the program tonight. We're glad you're here, Professor Kaplan. I mean, what's your read on this research paper?
Well, thanks for having me, Brent. I think, there's been a lot of battle about racism in American healthcare. And partly the system does have a legacy, and I know not everybody wants to hear about structural racism, but there have been segregated hospitals in the U.S., formally so up through the 60s and informally since then. It would be hard to argue that racism has not impacted minority communities in a negative way. So if we're going to teach in the medical schools, we need to address that history, and I think that should be addressed. It's also true that minorities tend to drop out from medical school at higher rates than others. So something may be needed to be adjusted, if you will, as part of their education to make them feel more at ease or more respected or less anxious about what's going on in medical schools. There's certainly places which, until I can remember, when I was at the Columbia Medical School, was entirely white male. So there has been change, but I'm not sure everybody's comfortable. Should we segregate medical education? No, and that's not going to happen. Is it okay to have groups that meet by race, by ethnicity, that want to support one another? Yes.
Mm-hmm. Let me ask you, the organization Do No Harm, they've denounced this article for advocating what they see as illegal discrimination, and it's also condemned the journal for publishing it. Is this an article that you think is acceptable for the New England Journal of Medicine?
I think it is. I think it reflects a segment of opinion among some, not all, people of color, minorities, about their discomfort with how medical education may or may not address race, may or may not address the history of racism. It has a place. Does every minority person agree? No. And, we do have efforts underway, we do at my school at NYU, to try and sensitize all of us to diversity, whether it's disability or race or whatever it might be. I think there is an issue. I think there's a real problem. I think the New England Journal was brave to publish this particular piece because it's going to stoke up in American culture wars opposition.
Many medical students we know who become physicians, they take what's known as the modern Hippocratic Oath. And it reads, I was just looking up to see, what the modern version is. It says the health of my patient will be my first consideration. It says my colleagues will be my sisters and brothers. And it says also I will not permit considerations such as age, race, ethnic origin, or any other factor to intervene between my duty and my patient. I mean, if you take an oath and follow that, haven't you maybe given yourself a guarantee that racism, at least in medical care, is not going to be a problem in your practice?
Well, I think that's aspirational, and that's great. but we also have to get down to the harsh realities. There are a lot of Americans who don't have health insurance still, overwhelmingly poor and minority. There are healthcare situations, deserts on places where indigenous people, Native American people live. The system still has a ways to go. So yes, I do believe that treating every patient, regardless of race, religion, ethnicity, as someone who merits the best care that somebody can give, that's an appropriate moral norm for a healthcare professional, doctor, nurse, whatever. But do we need to do more? Can we do more to support minorities as they try, if you will, to start to move into a system that has been historically run by the white majority? Yes, and sometimes that may require an affinity group. Segregated curriculum? No.
Professor Kaplan, we've got 30 seconds. I just want to get your take. The WHO today declaring the pandemic over. A good thing?
Well, it probably is a good thing, but only if we realize that the virus is still there and remains a threat to us. We should not simply say, that's over, what's next? We have to say it's downgraded in our priorities, but we have to be attentive. That's a dangerous virus still.
Professor Arthur Kaplan, as always, excellent analysis. Good talking with you. We appreciate your time on this Friday. Thank you.
Thank you for having me.